So the next hallmark will be invasion and metastasis. So now that the tumor cells are growing, it needs to invade into its local surroundings, and also it has to invade the blood vessels and go to distant sites for metastasis. So for metastasis to happen, there is a specific pathway under which this happens. Okay, so firstly, the tumor mass is going to be, so suppose this is the tumor mass, the individual cells has to detach from each other. Only then these detached cells can travel to a distant site, right? So for detachment, what is there? I already mentioned the cell addition molecule E-cadherin is the one which is holding the cells together. So with loss of E-cadherin, the cells can detach from one another. So first step is detachment of tumor cells from the tumor mass, which is going to be by the loss of E-cadherin. Okay. So once the tumor cells are detached, it is going to attach to the extracellular matrix. So surrounding the tumor, you are going to have extracellular matrix. So these tumor cells are going to attach with the extracellular matrix with the help of integrins. So once it is going to attach with the ECM, then what happens? It has to cleave this ECM proteins. That is when it can travel through the ECM to a distant site, right? So for traveling across this ECM, the tumor cells will produce certain enzymes which are going to be matrix metalloproteases. So MMPs are matrix metalloproteases. In general also, these matrix metalloproteases break down the ECM proteins. So these proteases will cleave down the ECM proteins and then enable the tumor cells to travel across them. Then next, it is going to breach, it is going to find a blood vessel, and it is going to breach the basement membrane of the blood vessel, again with the help of collagenases secreted by the tumor cells only. And then it is going to enter into the blood vessel. So inside the blood vessel, it is going to form a tumor emboli. So as such, if the tumor cells are traveling alone in the blood vessel, it is going to be acted upon by the inflammatory cells of the body. So the inflammatory cells will kill the tumor cells when they are separate. So the tumor cells will tend to mask themselves with either they'll form a mask with it will form a tumor emboli along with other tumor cells, or it could form an emboli with the platelets. So the body's platelets, along with that, it is going to form a tumor emboli, so that it is being masked. And then after forming this tumor emboli is going to travel in the blood system, and it is going to deposit at either a lymph node, or it is going to deposit in some other distant organ. So that is why they develop lymphatic metastasis, lymph node metastasis, or distant organ metastasis. So what determines whether a tumor cell is going to the lymph node or whether it is going to a distant organ? That is again based on the expression of certain proteins by the tumor cells. So the tumor cells will reach the distant organs if the tumor cells are expressing CXCR4 bar CCR7. Okay, if they express CXCR4 or CCR7, the tumor cells will go to distant organs, while if the tumor cells are expressing CD44, they are going to reach the lymph nodes. Okay, so distant metastasis has happened now. So regarding metastasis, we have certain MCQs again here. So there are some factors which promote metastasis, where there are some factors which are inhibiting metastasis. So promoting factors are esrin, microRNA 10, snail and twist. So this esrin is going to be there in this promoting factor is actually seen in rhabdomyosarcoma. Okay, it is involved in the pathogenesis of rhabdomyosarcoma. Then snail and twist, they are actually involved in breast cancer. And the snail and twist, again, we must have already read this in the EMT, that is epithelial mesenchymal transition. So an epithelial cell, if it as the name suggests, the epithelial cell is going to acquire the property of a mesenchymal cell, that is, it is going to become spindly, and it is also going to acquire the property of contraction, so that it can travel from one place to another. So because of this EMT only, the cells are able to metastasize. So snail and twist are transcription factors involved in the EMT. So when EMT is there, it is obviously going to cause distant metastasis. So the factors inhibiting metastasis will be NM23, Chi1 and KISS. So this Chi1 is going to be involved in the pathogenesis of prostate cancer, and KISS in the pathogenesis of melanoma. So these again can be asked as MCQs. Okay.